In EMDR therapy, we use bilateral stimulation as a way of helping our clients process the information. As you know, there are three types: the auditory tones, bilateral taps, and also bilateral eye movements. In this video, I will help you decide which type of bilateral stimulation to use with your client. Please join me. Welcome, I'm Dr. Michael Paterson, clinical psychologist and EMDR Europe accredited senior trainer. In 2013, Lee and Kuipers published a paper, a meta-analysis, looking at studies which had used eye movements and the impact of those. Some of these studies were carried out by people with a vested interest in EMDR therapy. Other studies were carried out by those who had no particular axe to grind or particular interest in EMDR therapy itself. What the paper tells us is that bilateral eye movements have a significantly superior effect compared to exposure-based therapies in reducing emotional reactivity and imagery vividness. Because of this strong evidence base for eye movements, the received wisdom is that that should be the treatment, the method of bilateral stimulation of choice. I would always start off with bilateral eye movements with my clients. Sitting in the room with the client, in the ships passing in the night position, holding a pen up, or if you were having two fingers up, the client can track that back and forward. That's about 50 centimeters from the client's eyes. By doing that, it helps the client then do the processing. However, we have now become more aware of social distancing and how important that is. Currently, we have now become more cautious, and with social distancing, we could be sitting 2.5, 3 meters back from our client. In which case then, it's going to be very difficult for you moving your hand back and forward for the client to track. In which case then, you can invite the client to do their own eye movements. What we're trying to do is get the client to move their eyes as fast as they can manage without strain. If they're tracking your fingers back and forth, they can do that very rapidly. But if you're inviting a client to move their eyes themselves, invariably they won't move them as fast as they would had they been tracking your fingers. What are we going to do then? Because part of the role of the eye movements is to tax the working memory. We do have that working memory hypothesis, which you may be aware of. In terms of that working memory, there is a limited space available for our clients to process information. If we invite them to link to a target memory without doing any bilateral stimulation, it could be using up all that space that's available. But by adding in bilateral stimulation, such as the eye movements, we can reduce the space available for that disturbing memory to sit. By doing that, the client learns very quickly this event is in the past. They process that, it gets stored away. Another piece of information comes up from the long-term store. They can process with that too. It's a bit like playing tennis with a serving machine serving a ball. So it fires a ball, you hit it back. It fires another ball, you hit it back. It fires another ball, you hit it back. Similarly with our clients processing. New information comes up from the long-term store. It gets processed, hit back, and stored away, consolidated. What do we do then if we are doing slower eye movements? Well, it means that less of this working memory is being used up doing the eye movements. It's okay to introduce another form of bilateral stimulation. You might invite the client to do tapping at the same time as doing eye movements, such as in this little video. As you can see with Hazel, what she was doing was moving her eyes at a different rate to what she was tapping. That's okay. Some clients you will find will move their eyes to the left whenever they're tapping that side, moving it to the right when they're tapping that side. That's okay too. By doing the two forms of the bilateral stimulation, you add extra taxing of the working memory. That also helps the client process. I hope this video has been helpful to you. If it has, please click like down below. If you haven't already subscribed to the channel, please do so. YouTube can let you know about the next video I post in the series. I want to help you become the best you can possibly be in delivering EMDR therapy. And together, you and I, we can make a big difference in the world. Thanks for watching.